subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We're here today on a bright in some parts of the country and rainy in some parts of the country, August Saturday. And we have here with us once again, Dr. Divya Prabhat. Dr. Prabhat is, as we know, a well-known ENT specialist. He completed his undergraduate and postgraduate studies from the GS Medical and KEM Hospital in Mumbai, and then worked there as a lecturer for 4 years. He trained in ear surgery for deafness from Germany and done his cochlear implant training at the Royal Australian Hospital in Melbourne. He's the author of 4 books on ENT, of which Practical ENT is in the 31st year of publication. He has over 40 published research articles in various national and international journals, and is also on the editorial board of 4 index journals. He has delivered over 400 lectures in conferences, etc. And he is an ENT consultant to the online site Pediatrics on Call. He's section editor and author of the ENT section of the IAP Textbook of Paediatrics, Textbook of Adolescent Medicine, IAP Color, Atlas of Pediatrics, and Textbook of Tropical Allergy and Asthma. He is head of the Department of ENT at the Wadia Children's Hospital in Mumbai and is consultant at the Jaslok, Raheja, Fortis, and Bhatia hospitals. He has been a guest speaker at the World Congress of ENT at Sydney and Cairo, and also at Washington. He's an examiner for the MBBS DORL, which is a specialization in ENT, and MS examinations. He was president of the Association of Otolaryngologists of India and nominated in the top doctors from 2013 to 2021 by India Today magazine. Welcome once again to Health Live at Seniors Today, Dr. Prabhat. How are you?
Thank you, Mr. Maheshwari, for a very generous introduction. And of course, it's always a pleasure being on Seniors Today. And of course, the response that you get and the good work that you're doing in society, I mean, hope to continue it for the future.
Thank you very much. Thank you very much for your kind words, and thank you for being here. Doctor, as we always do, and unfortunately, every time we think that we will now stop this introductory chat about COVID, what's the scene now? We hear about H1N1 now raging. Is that how serious is the concern now?
Yeah, I mean, we of course do get patients with COVID positive test results, but fortunately, I mean, hardly ever any of them get admitted with us. So basically, things are much better probably after the doses of vaccination, and probably even the level of virulence has reduced with all this actually.
Right.
So we are much better off from what we were earlier.
So we have Dr. Divya Prabhat here going to be talking about allergic rhinitis and the syndrome that it is. And over to you, Dr. Prabhat, for your presentation. Those of you who have questions, please put them in the Q&A tab. And as always, mention your gender and your age, and we will pose the questions to Dr. Prabhat once his presentation is over. So put them in the Q&A tab and we will ask all the questions. Thank you. Over to you, Doctor.
Thank you. Good evening, friends. And we'll begin with this talk on allergic rhinitis. So basically, allergic rhinitis is not a single term, it's a syndrome. It is a syndrome by the means of sneezing, nasal block, and nasal discharge, what we find in response to an allergen, and medically we call it an antigen. And the incidence has been increasing over the years, that the number of people getting allergic rhinitis is very high, and how it does not limit itself only to the nose. It goes to various different parts of the body, and I'll briefly take you over to all this. So allergic rhinitis is a condition which affects the quality of life. The loss of man days is very high, and it's one of the 10 commonest conditions that lead to the doctor, I mean, the patients coming to primary care physicians. It's one of the probably topmost conditions which leads to this. It's quite a frustrating condition. It's quite a frustrating thing where allergic rhinitis may just go on and on for years, decades, etc. Now, the reason is that with industrialization, etc., the quality of other percentage of allergy has increased, and from 20% it has become 45% as far as many of the international reports say for Western countries. And even in India, the incidence, which was earlier 10% of the population was affected, now we find about 25% of the population being affected because of this. So that gives you an idea to the enormous involvement of allergy or allergic rhinitis. And as far as allergy is concerned, globally, the number is huge. It's massive. In our country, the incidence has increased, and even newer reports show that from 25% it has gone to 30%. And amongst all the allergies considered together, allergic rhinitis as a single entity is the highest involved allergy for any particular area in the human body. So 55% of allergy is actually allergic rhinitis, and therefore the importance that we'll go through it in today. Now, the changing scenario today is that we have, with the usage of mobile, our whole activities have reduced. We have the body weight has increased, the BMI has increased, and that is changing lifestyle that has led to increase in the allergy. And I'll just go into the various conditions why this is occurring. So medically, it's an IgE mediated response, which leads to inflammation of the nasal airways in response to a stimulus. So it is an immunoglobulin, that is IgE mediated response, which leads to inflammation of the respiratory tract. Now, particularly, especially even in the elderly population, what we call is they suffer from chronic rhinosinusitis. What happens that there's certain inflammatory cytokines in the body. You must have heard of IL-6 and all, which was very commonly discussed during our COVID times. We find even the neutrophilic inflammation is high, and with that immune response to the pathogens, this leads to blockage of the nose and blockage of the sinuses. So persistent allergic rhinitis, as I said, may be a frustrating experience. People go from doctor to doctor, doctor to doctor, and this is like one of my patients who was an electrician. I mean, he was so frustrated with his nasal block, no medicines were working, and he just devised a wire which used to keep his nose open around the nose, around the head, and only then did he get sleep. So nasal blockage or persistent can be that frustrating. Now, basically, what are the symptoms that lead to these allergies? As I said, it's a triad of sneezing, nasal block, nasal discharge. Along with it, there may be even lacrimation, that is the eyes get red or congested, or there may be congestion, or you can say urtic area, or the skin gets inflamed. So typically, these are the things that one would diagnose allergic rhinitis. We do not require any investigation. We do not require any form of even scan to find out whether it has this is allergic rhinitis or not. The diagnosis is written on the face of the patient. To avoid it, frequently we are told that we should keep the bed sheets clean, wash our hands, etc. Now, the common allergic triggers in our day-to-day life would be strong smells, dust, a humid climate, dust mites, molds, various pets, plants, the pesticides that are used, smoking or tobacco smoke, and certain food and medications. But the globally most important allergens that are seen are the house dust mites. There would be pollen or the grass. Typically, we see it during the fall season, etc., or even when the pollens are very high in few of the countries. The pets which are there around us are strong allergens, cockroaches and molds, which also lead to various antigens which are released. Now, common foods that we eat, one has to be careful of those who are allergic. They have very high incidence of milk being an allergen, milk and milk products that may be like even cheese, buttermilk, etc. Okay, because milk is again an animal protein. It is not for human consumption, and therefore it's a strong allergen as far as human beings are concerned. Then eggs, fish, crabs, almonds, peanuts, wheat, and soya bean. These are the common food allergens that lead to allergic condition. But however, what you require to know is the new allergens. The new allergens include the various air conditioners. Now, practically most of the places where you go, you find air conditioner fitted. The rooms are closed. So the air conditioner is a very strong media for the allergens or the fungi or the molds to grow, because it's a dark, closed, moist cavity where these ducts and all, or even the filters are full of dust. They are harboring, or it's a media for allergens to grow. And that is one of the very common causes of allergic rhinitis. Day-to-day life, the usage of various deodorants or perfumes, because all of them contain propane or butane as a propellant where the sprays are used. The various antiperspirants, they contain aluminum salts, and which are again very strong allergens. Even in talcum powder, like asbestos and all is used, which is not only an allergen, but is found to be carcinogenic also. So the usage of various deodorants, perfumes, talc powders becomes an allergen. To add to the list, there are the mosquito repellents, like the various products you see, or even the coils that are burned to uh, drive away the mosquitoes. Even the incense sticks may contain chemicals, and those fumes trigger an allergic rhinitis attack. The new allergens also includes the various processed foods, the foods which are supposed to have a long life. And the reason is that the allergens in the food are the colors which are given to it to make it look attractive. The various flavor enhancers put in these foods to, of course, so that they sell better. The various preservatives put so that they have a better shelf life. They can be kept in the stores for 6 months, 1 year, etc. So all these act as allergens in the food, and therefore it is important that we have to eat what is grown on plants and what is not made in plants. So all processed foods, packed foods are strong allergens, which, needless to say, should be avoided. Now, when we consider the nose per se, the lining of the nose is not just isolated. As you see in the picture, from the nose, the lining goes into the sinus, it goes to the ear, it goes to the throat, and finally to the lungs. So from the nose till the lungs, till the sinuses and the ear, you have a single continuous mucosal lining. So what happens with these things is that if you see, the mucus constantly flows out of the sinus, which goes down into the throat, and we swallow it. But so if the sinus is blocked, it leads to sinus infections and various polyp formations. So that is how this happens. So typically what would happen, that starts off as a basic allergic rhinitis, where certain chemicals are released in the mucosa, and these cause inflammation or swelling. And thus inflammation or swelling of the sinuses leads to sinusitis, what is commonly called as sinusitis. And if the sinusitis persists for a long, the secretions get infected, pathogens form, and they solidify inside, to call it chronic sinusitis, or it leads to a polyp formation in the sinus. So if you see, basic allergic rhinitis is just inflammation of the lining of the nose. But when there is inflammation or rhinosinusitis, the opening of the sinuses, you can see the infection and the pus, and that remaining for a longer period leads to solidification, which forms typically a nasal polyp. So it is inflammation that leads to this. Now, there are also various non-allergic causes which lead to the similar complaints. So vasomotor rhinitis, which is termed as. Now, vasomotor rhinitis is again a triad of same: sneezing, nasal block, nasal discharge, but there is no allergen. there is no stimulus. So what is the cause of it? There are hormonal causes of vasomotor rhinitis. Hormonal would mean that you see more congestion of the nose, typically like during menstruation or during pregnancy. Or in fact, there's a condition which is described as also as honeymoon rhinitis. There may be overuse of local medications. People have habits of using inhalers or sticks. They keep it in their pocket and they keep on snuffing it, or even snuff, etc. They keep on smelling it for opening the nose. The overuse of that leads to vasomotor rhinitis. There may be atrophy or drying of the nose due to bad local hygiene or even vitamin deficiencies. It may be drug-induced nasal congestion, like for example, some of the antihypertensives, some of the decongestants, they can cause nasal congestion and even a deviated nasal septum. So one of the studies which we had done a few years ago, we found out that 98% of the physicians all over, we've done it for in about 25 cities in this survey, that 98% of the physicians in our country believe that allergic rhinitis was the cause of repeated respiratory tract infection, and we need to address allergic rhinitis as a single entity itself. Now, what happens? This is like you're going on a long journey on a road with on a cloudy night, and on the cloudy night, when you are in your car, you see one of the indicators on the dashboard start flickering. So when you see an indicator coming, there are two options that you have. Either you continue driving, or that when you see an indicator, you go to the side, park your car, open the bonnet and see whether there is enough engine oil, petrol, the connections are fine and connected, and then go ahead. So basically, this is something like that. This is just a symptom that you're getting earlier. And if you find out what the reason is and correct it, it will prevent a lot of conditions happening at a later date. So this is just to show you that how a nasal block causes this problem. So you can see how when there's obstruction of the nose, the passage is open. The passage of sound leads to production of sound, what we call as snoring. This is typically snoring occurring in the person. So snoring is one of the common things that may happen with a nasal block. And long term, this leads to a condition which is obstructive sleep apnea. Obstructive sleep apnea is when there is cessation of respiration for, you can say, about 10 seconds. And this is there for at least, you can say, 8 to 10 times in an hour. So if that occurs to that frequency, a person is labeled with OSA, or obstructive sleep apnea. This is one of the precursors to type 2 diabetes, to hypertension, and to various other metabolic syndromes like hypercholesteremia, hyperlipidemia, etc. So what happens that when the nasal passage is open, air would flow from the nasal passage directly into the nasopharynx to the throat and goes down to the lung. But with allergic rhinitis, the nasal passage, you can see it is reducing in size. And as it reduces in size, the nose becomes narrow. And as the nose becomes narrow, that negative pressure would pull the soft palate backwards. The uvula hits against the pharynx, and even the negative pressure pulls the tongue behind. This also leads to opening of the mouth and mouth breathing during sleep. So this production of sound of snoring comes from primarily the soft palate hitting against the pharyngeal wall and the base of the tongue, which leads to snoring, mouth breathing, and reduction of oxygenation as far as the whole body is concerned. There's a greater load on the heart also. So what is required is we have to treat the nose so that the nose opens up, oxygenation becomes adequate, and that will make the tongue come in front and the mouth closed also. So that will be the main form of treatment that we require to do. So this is what happens that if this is a nasal septum and this is the lateral wall of the nose, and you can see the large turbinate which typically occurs with allergic rhinitis. This is how the turbinate should be. It should be smaller in size. So here, of course, immediately you can see it is reduced by laser. Again, it is further reduced and the turbinate is practically down. This is a Gauss piece inside. So it is this obstruction. You can see the obstruction is so severe that hardly any space remains there in the nose. So nasal breathing is important. Now what happens that in allergic rhinitis, we can say why it is important is that 80% of them asthmatics suffer from allergic rhinitis, and 60% of the asthma patients have sinusitis. So the incidence is to that tune. Now, from the tip of the nose till the terminal bronchi of the lung, you have a single respiratory epithelium. Medically, we call it pseudostratified columnar epithelium with cilia, which clears the mucus. Secondly, the triggering factors in the nose and in the lungs are the same dust, pollen, pollution, etc. Then the chemical mediators to these allergens released in the nose and released at the level of the lungs or the bronchi are the same. And lastly, the drugs acting at both the levels are the same. So allergic rhinitis we see in childhood or in adulthood, if it does not clear, as one grows older, this is the precursor to asthma. So in short, we can say that allergic rhinitis is asthma of the nose, just for an easier understanding. So allergic rhinitis definitely would lead to asthma if it is not controlled and not taken into consideration. Now, since as I earlier said, the lining of the nose is continuous with that of the sinuses, so this leads to sinusitis. Allergic rhinitis leads to then later on polyp formation, leads to respiratory tract infection. All ear infections are occurring because of allergic rhinitis, and finally it goes down and causes asthma. So these are all preventable conditions of allergic rhinitis, which not only leads to asthma, but asthma and other conditions may be obstructive sleep apnea, snoring, that is, then that may lead to hypertension, diabetes, and metabolic conditions. So where there is a wheeze, there is always a sneeze. The nose is clear, the lungs, the airway remains clear, and lungs and airway clearance is very important, and especially in all these viral infections which we have seen with, even in the COVID times and all, where oxygenation plays a great role as far as the whole airway is concerned. Now, if you see the airway is clear and it passes on, even ancient medicine has shown us that it improves the quality of sleep. You can focus better with it. It lowers the blood pressure, anxiety, and the lung capacity is better. So what is important is a clear nose, a clear airway, very important for the whole body itself. And these are all preventable conditions. We can prevent it. It is easier to prevent it than actually after the damage occurring. And prevention is, as you know, the old adage is better than cure. So allergic rhinitis is a syndrome. It is on the increase. In the last 2 decades, the incidence of it has doubled. It's fully preventable, quite preventable and avoidable thing. Not only the nose, you have multiple organs that are affected, and it improves the quality of life of the patient. And so therefore, it is important to be educated as far as this is concerned. And unless educated, you will not know actually what to do. So simple problem. As you see, this is an actual condition which happened in our patients also. So we have had people using it like this also. So patient education becomes very important. Thank you. Thank you for your attention. Over to
Thank you very much.
Mr.
Thank you very much, Dr. Prabhat, for
Yeah.
a very detailed presentation. So clearly, what is emerging from your presentation is that the number of cases of allergic rhinitis, is increasing, and given all the dust and the various allergens, and and air conditioners and fragrances and all of that is leading to it. But would you say that the numbers are more perhaps in certain parts of the country and lesser in some parts? For instance, it may be more in a Mumbai or Delhi, than say perhaps a Pune or a Bangalore, etc.
Yeah, in fact now Pune and Bangalore has also become Bombay, Delhi only. But thing is, it'll be lesser in the rural areas as such. I mean, but as I said, with industrialization, with air conditioners and all, the incidence is very high over here in our cities. And
So,
sorry.
Doctor, a question to you. Normally, one would ask an air conditioner technician for this, but how often should one get an air conditioner serviced, the filter, etc.? How often should you get it serviced?
Yeah, at least once in 3 months.
Once in 3 months. And is it only the filter or the entire AC unit?
Entire AC unit, because what happens is these ducts inside or the internal parts of the air conditioner. This is a very good source, unfortunately a bad source for fungus and molds to grow, because it's always humid, a dark, closed place. So fungus and molds don't find it very easy to grow in such corners, basically.
Because normally the air conditioning contracts that you have, they do not do the deep cleaning, and you need to get one of these. Now you have a service provider, which does all these things on a case-to-case basis. And I got it done. So which is why I'm trying to figure whether. So you are recommending a deep cleaning of an air conditioner every 3 months.
Exactly.
To ensure. And okay, doctor, we have a few questions. One is from Mr. Dinesh Paliwal, who says, where can the allergen tests be done in the city of Mumbai, and I guess elsewhere as well?
Yeah, most of the labs, the big labs, NABH accredited labs, they do the allergen tests and all. I mean, they have a list of maybe 300 or 400, 500 allergens. So if you have to find out which food or which particular item you need to avoid, so you can get a test done.
Thank you. We have a question from Mr. Devendra Ganguly, who says, I'm 62-year-old male. I have had all these ENT problems for a while now. I use a CPAP machine and I have polyps. Would you recommend surgery?
See, maybe that surgery may not cure you totally, but definitely your CPAP titration will come down. If the nose is the only issue, only then you would be fine, because there are certain other factors like obesity, for example, or even if somebody is using a sedation, while sleeping, which reduces the respiratory drive. All these things will definitely reduce the oxygenation. So if nose is the only cause to it, you would improve, or otherwise surgery would reduce the titration or the amount or dependence on a CPAP.
Right. Thank you. We have a question from Mr. Malcolm Montero, who says, I'm 69, suddenly developed allergic rhinitis in Jan 22. Found out I was allergic to dust and dust mites. Some food items, both veg and non-veg. Difficulty in breathing. What could have caused it? Excess protein intake? Or is it because of medication that I was taking for something else? Will I be able to eat again those items that I've been avoiding? And how long will it take? Is it reversible? Quite a few questions that he has had.
Yeah, basically, as I showed you, I mean, a lot of these things like egg, milk products, or even fish, they are very strong allergens. So avoidance plays the key in this. So you have to avoid these things. When you can eat is what we do is we ask the patient to avoid them for a year, 2 years. So what happens? The body forgets, we try to cheat the body. The body has a certain memory in allergy, which is a late phase of allergy. So allergy never occurs on the first instance when you're eating something. It is the second or the third function where the body remembers and the late phase of allergy occurs. So you require to stop it for a year or two, and then we start introducing one item. And if you don't get allergy with it, you can eat it. But if you get it again, then you don't have it for future. So prevention is better than cure in this, basically.
Thank you. We have a question which I'm not in agreement of in terms of asking, but because it names a specific drug. But the fact of the matter is that a lot of people consume medicines like these. So how safe is it to manage allergic rhinitis by having an Allegra a week before the season changes? Does a flu vaccination also control this?
Yeah, so basically, as you spoke about fexofenadine is an anti-allergen, and only thing is you cannot take it. There's no point taking it before you're getting an allergic attack. I mean, there's no role for to take the medicine around the year. So it is not that, if you take that medicine, you would not get allergy. So basically, I would suggest don't take any medicine in anticipation that you are going to get allergy. Try to improve your immunity, improve your lifestyle, change your lifestyle, and avoid certain food articles.
Right. Thank you. We have a question from Sandeep Jain. He hasn't mentioned his name. I seem to be allergic to dust, aftershave, fragrance, scents. In morning, I go through a series of sneezes, sometimes running, and then within some time, it steadily reaches normalcy. At times, I do take anti-allergy medicine for quick relief. This phenomenon is occasionally, besides its sneezes, in action often collapses, which is very irritating. Please advise.
Yeah. Now see, supposing you're getting it with these aftershaves or something, so you have to either change the brand or you'll have to stop using aftershave lotions, but basically by changing the brand, you can just try out other ones and you would be the best person to tell that whether I can use you're comfortable or not after it. But if you're getting allergy with it, there is no point continuing with your whatever favorite aftershave lotion. And the main thing is that there's nothing to replace avoidance.
There is nothing to replace avoidance
of these allergens. Yes.
Absolutely. In the good old days, one used to use alum.
Alum, the fitkari, we call it.
The fitkari. And I must tell you that I managed to locate one recently and I got it and it works better than an aftershave. Doc, we have a question from Usha Jacob. She says, Doctor, I do pranayam daily. I have a clear breath. I don't have asthma or any breathing related issues, no visible allergies. I have very sound sleep, but I snore. It's not snoring. And sometimes it's so loud that I feel very embarrassed. Are all snoring related to allergic rhinitis? That's one question. And another question is from Dr. Ramesh Sete, who asks, how can snoring be controlled? Please suggest a remedy.
Yeah, so basically snoring can be because of multiple causes. There may not be the commonest one is a nasal block where air passes through an area of constricted area and that leads to snoring. However, as I said, those who are having a large neck, I mean in males if the size is more than 42 and in females if the size is more than 40 inches, what we call it the collar size, that then they're prone to snoring because it basically reduces the airway size. Secondly, even the positioning of sleeping can cause it. Thirdly, what may happen that some of us have a jaw which is inside. It is called as medically retrognathia. So if the jaw is retracted, then there's a tongue fall during sleep and that can cause snoring. So there are other factors also. It can occur in the nose, it can occur because of the throat, because of the jaw, or because of the larynx, also the airway. So it is not only that the commonest is in the nose. Therefore, it is like synonymous with it. But there are other causes also to snoring. Even if you don't have these, there may be other reasons, because of which one may get snoring. And Dr. Shete, as I said, most important is the nasal passage should remain clear. So typically you have to avoid allergy. And if at all there are polyps or there's a deviated septum, which means that there's an anatomical reduction in the diameter of the nose airway, then that would need to be corrected.
Right, thank you. Mr. Sandeep Jain asks another question, how to avoid sneeze collapse? The sneeze comes, but it stops suddenly. It is very irritating. How does one handle this, please?
No, I mean, don't try to control it. If it comes, you sneeze, and if it doesn't come, you don't. But only thing is when you're sneezing, preferably, I mean, to prevent infections or any affliction of the ear, you should preferably keep your mouth open and sneeze. So that will, at least your ears and all will be protected with that.
Thank you. Mr. Narendra Shah, he's 70. He says, I'm having a coughing problem. What is the possible solution?
Coughing problem, again, most commonly is a postnasal drip. In allergic rhinitis, where the turbinates swell up, there is a discharge which occurs in the throat that irritates the throat and causes coughing problem. And other reason is that the nose gets blocked. So we open the mouth and breathe in between. We become habitual mouth breathers. And when we breathe from the mouth, the various dust particles, even the pollutants, all of them directly enter the throat, irritate the pharynx, and leads to cough. The third reason could be because of a reflux. Reflux meaning the acids from the stomach coming up or the gases coming up, irritating the throat and causing dry cough.
Thank you. We have an anonymous attendee who's asked, would like to know if allergic rhinitis can lead to pharyngitis or bronchitis in future and how to prevent this. I guess you've answered this question, but okay, we have another question from Rakshit Mafatia, who says, I have a problem of one of my nostrils getting blocked in the night while lying on bed, which restricts my sound sleep and timely sleep. What can be the remedy?
Basically, a unilateral, that is one-sided block, typically during the sleep, is an indicator that there could be a deviated nasal septum, that the nasal bone is deviated to one particular side. So when one sleeps on the opposite side, the blockage becomes evident actually. So one would think of getting an X-ray or a scan done, and the diagnosis is clear.
Right. We have a question from Shifa Sheikh. I don't know whether we have an answer for that. What is the treatment for dust allergy? Doctor, would you like to take it?
Yeah, I mean, first of all, it's more of a holistic treatment. We advise them that you eat well, sleep well, be mentally relaxed. As I said, even stress also causes vasomotor rhinitis. Typically, we find patients, who are coming that they have an exam or there's a marriage in the family, or, a lot of stress is there and they get a lot of allergic rhinitis. So allergic rhinitis gets stimulated even with a lot of stress, if one does not sleep well, etc. Secondly, we start with medication, and whatever inflammation is there, supposing in the nose, if there's secondary infection like sinusitis, you have to treat the sinusitis. If there are polyps, they're required to be treated to prevent the allergic rhinitis. Other thing is, one requires to go further, then immunotherapy is given, where the immune status of the IgEs, which immunoglobulins which increase, they are tackled by certain medications.
Great, thank you. This is a question from an anonymous attendee again. While talking, after a while, my voice chokes and little amount of cough needs to be removed.
Okay, so that may be occurring. One, it could be because of reflux, where again, as I said earlier, acids come up and they cause inflammation in the pharynx, in the throat. So whenever it is stimulated, it may lead to cough production. And the other reason could be that if you must be a perpetual mouth breather, if not breathing from the nose, as the function of the nose is to clean the air, filter the air, and the air, and take that clean air down into the throat, into the lungs. So if one is having a nasal block and mouth breathing, the throat would get inflamed, and therefore, on beginning speaking, one would start coughing at that moment.
Doctor, we are talking about rhinitis, but we have a question from Mr. Shankar Chauhan, who's 82. And since, it is about hearing, we thought we'll ask you this. He says he is having a difficulty in distance hearing. Any remedy? He's already using a hearing aid, but with no favorable result.
One common reason would be even allergic rhinitis, where the eustachian tube gets blocked. And as I said, the lining of the mucosa of the nose is continuous with that up to the ear. So if there is allergic rhinitis, there will be blockage of the eustachian tube, and that leads to fluid collection in the middle ear, in the ear, which is causing a conductive hearing loss. So even if you use a hearing aid, I mean, the sounds won't be clear if there is fluid in the ear. So your nose, if it is clear, even your ears and the middle ear and the eustachian tube would clear up. So very important to tackle allergic rhinitis, even for most of the ear conditions.
Doctor, there are two more questions which I want you to ask. One is, there's somebody who's asked, who's 76, has allergic rhinitis. How often should I take nasal spray off-lute flow?
No, I mean, you don't require to take it continuously. Basically, if you want to take something continuously for in allergic rhinitis, just to keep the nose clean of the various antigens or allergens, is a saline nasal spray. Saline is normal salt water solution, which is 0.9% salinity. It is the same as the normal salinity of the nasal secretions or body fluids. So that won't have any side effects to it. It will clean up the various clefts in the nose where dust and these particles get lodged. It will enhance the mucus clearance, because every 20 minutes, our nose and sinuses clears the mucus. We don't clean our nose every 20 minutes. So therefore, when you do this, the normal cilia, which push out the mucus from the sinuses and from the nose down into the throat, they clean the nose every 20 minutes. They remain clean and they function well. So you can use saline sprays for a long period, but you cannot use the other sprays for a very long time.
Doctor, one last question. This is from Sandeep Jain again. Are generic substitutes good for anti-allergic tablets because they are more pocket friendly?
Definitely, they are all the same. I mean, you can use generic products.
Right. And is steam inhaling fine? This is Suresh Khate is asking. He frequently gets a cold. After every alternate day, he gets cold, a lot of sneezing and nose flowing. Due to this, getting disturbed sleep and then headache. So will steam inhaling help?
Yeah, steam inhaling will be useful because it will clear out the mucus, the thickened mucus, which prevents the flow of the cilia and the sinuses don't clear up. So but only thing, one should not overdo it. 1 or 2 minutes is enough. When people overdo it, and when you overdo it, you may damage the cilia itself.
Thank you very much, Dr. Prabhat, for all this time. A fantastic presentation and very detailed responses to all our questions from our readers. So thank you very much for being here once again. I will just take this opportunity to thank everyone else for being here. There have been times when some of you have not received information in time about the health webinar. So what I recommend is that you should fill up the registration form, pre-registration form, so that we will mail you as soon as we have we log in the session, the next session. So for instance, we have a session fixed up for next week, and we will announce it on Monday or Tuesday, and you will get an alert instantly about it. Apart from that, Seniors Today magazine has just come out last week. We did take you through the issue last week, but I'm going to take you to a short video, Dr. Prabhat, just 2 minutes. So I'm going to ask our producer to show that video. It's a very interesting video, which we have, very interesting content that we have on the occasion of India turning 75 years of independence. So yeah, here goes. There's a problem with the audio, so I'll just go through this thing, which is Mera Bharat Mahan is where is the topic, and so we have an essay about on the subject. Then we have a special quiz, so 75 questions on India's 75 years. We have this interesting article by Kishori Amonkar, by one of her favorite disciples, and something about Meghalaya, an amazing place, and epic soundtracks of Hindi cinema across 75 years. So that's our latest issue of Seniors Today. We've just, it was out on the 15th, and as always, it is available free of cost, free for you to read, and you can do that on Seniors Today, the website, which is seniorstoday.in. Those of you who are aware, Seniors Have Talent, our special event for senior citizens 60 and above, is on. It has a new day now, which is a Wednesday. Those of you who would remember, Wednesdays was a day for Binaka Geet Mala, and it's a Geet Mala day once again. Every Wednesday is Seniors Have Talent. One of the reasons why we've shifted it from Sunday to Wednesday is because now the lockdown is over and people have their weekends busy, so which is why we've shifted to Wednesday. So that's where we are about Seniors Have Talent. That apart, a host of events which keep happening every day, engaging senior citizens. So in our 3rd year of existence, it's been an amazing journey. Thank you very much, Dr. Divya Prabhat, for this session on allergic rhinitis. It will be on seniorstoday.in, the website, on Monday and Tuesday. We will have the takeaways of the session plus the edited video, which will be both there on seniorstoday.in next week. So those of you who are subscribers to our newsletter will of course get alerted about it. Those of you who are not, you must subscribe to the newsletter, or of course keep just accessing the website. Thank you very much, Dr. Prabhat, once again, and thank you everyone. Bye.
My pleasure. Thank you.
Subscribe now and press the bell icon. Never miss an update.